Hello, my name is Emily White. This week's topic was long-term care. The New York Times article that I found was called Many Americans Will Need Long-Term Care. Most won't be able to afford it. And I found it to be very informative and interesting. So the article starts out with a story that's told by Miss Harris. She's a retired attorney, and she explains how she has many health problems. She has non-Hodgkin's lymphoma, heart disease, osteoporosis, and rheumatoid arthritis. She's concerned that she's going to need long-term support. She doesn't have a family nearby, she's divorced, and she doesn't have any children. So she's most likely going to end up in long-term care. So she's concerned she won't be able to pay for it for herself because she makes too much money to qualify for Medicaid, but not enough to pay for long-term care. So she gets an income of about $4,600 a month, and even if she sold her house, she would be still be too short. Not enough to qualify for Medicaid, and not enough to. She doesn't have enough money in her savings to pay for long-term care. The forgotten group is typically middle-class adults who make too much money to be given Medicaid, but they don't make enough money to be able to afford to stay in long-term care. So they're typically forgotten about and put in a bad position when they're unable to afford long-term care. So, according to the National Health and Retirement Study, one half to two-thirds of American adults will end up in long-term care facilities or need long-term care. 14.4 million people fall into the middle income category. These people likely have not experienced poverty, but will have trouble affording assisted living, especially because today's adults have much more debt and typically less savings. So this middle group gets ignored, and if this problem continues without ways to mediate it, things are going to explode. Next up, the article talks about independent living. Independent living provides some services, but not 24-hour care, so it gives the people a sense of independence, and it's also a lot cheaper. But for some people, this care won't be enough. For example, people who have extreme dementia or Alzheimer's, they need 24-hour care, and this just would not be enough for them. So the article next talks about Social Security's cost and Medicare's cost. So Social Security's costs will soon exceed their income, and the program is predicted to go through its reserve in 16 years. The program will not dissolve out, but benefits will definitely decline if something is not done to change this. So with Medicare, they provide pay for doctors, hospitals, and medication, but not for assisted living. So a solution to this could be including housing costs as well as healthcare to kind of take off the financial burden from the seniors. The article concluded with a quote from the health policy researcher at Harvard Medical School, and he said that a lot of us are going to get stuck in the middle, and it's pretty scary. This is something that I'm definitely concerned about too for myself now that I have read this article and read more about like the forgotten middle group. I'm definitely scared about how that's going to go with myself, not only myself, but my parents too, because they're middle class and I'll most likely stay middle class. So it's definitely something to prepare and save up for. So I found this article to be very eye-opening and informative and also a little sentimental because I do have a personal connection to this article. So the personal connection I have to this article is my grandmother. She has Alzheimer's and has been in nursing homes and assisted living for the past 10 years. She's currently on hospice right now. I would say she's middle class throughout her life. She was pretty well off, had a good job. Long-term care is extremely expensive. She was able to support herself and her family all her life, but when she started living in nursing homes, she burned through all her money and her savings too. She now gets very minimal amount of money from the government each month, and when she passes away, she will have no money to pass on to her children because the long-term health care facilities depleted all of her money. I just find this a little unsettling because she was able to support herself and her family her entire life, and ever since she's been in nursing homes, she has zero money. Like, she gets $50 a month to herself from the government. It's just a little upsetting, and I think that something should be done about that. The long-term nursing home facilities that she has been in, for the most part, they were average. They did their job, not well enough to be paying $5,000 a month to stay there. Some of the nurses I've encountered were a little rude to my dad when he was asking questions about his mom. There's different nurses and care people in and out every day, so it's not really consistent with who you're seeing, so you're not really getting too comfortable with some of the staff. There is a good side, though, to some of the long-term care facilities that my grandmother has been in. I know I've seen so many nurses make a good relationship with her. The nursing homes put on like games, the food's good, so there's definitely are some positives to the long care health systems. The place that she's at now is called Cardinal Village, and they have two different types of care levels, I guess you would say. There's an assisted living side and a non-assisted living side. So the non-assisted living side is where you still need some supervision, like with medication, and they give you food and whatnot, but you don't have to like check in at certain times. You're not under 24-hour care. So you feel more independent. And then the assisted living side is when you have 24-hour care. They like bathe you, they feed you, all of that. So she's been on both sides actually. So after reading this article, I was very excited to learn more about long-term care and start my research. I learned that long-term care has 3 characteristics that one needs to qualify. The first is to have a physical or mental disability which interferes with a person's ability to do daily tasks. Another characteristic is if a person gets a debilitating illness or disability that requires care after hospitalization. And lastly, specialized environments. For example, a person with Alzheimer's or someone with birth defects that are going to need long-term care. 65 years old and older is the primary clientele for long-term care, but surprisingly, many older adults do not need long-term care because they can take care of themselves. There's also a good amount of younger people on long-term care that have gotten a disability, injury, or car crash. There's 2 different types of long-term care, community care or institutional care. Many cases of long-term care is provided by family members who take care of their relatives but don't get paid, and it can definitely be exhausting for them. Many older Americans prefer to stay independent and live in their own homes or communities. Furthermore, most Americans who are widowed or have no family end up in institutional care like nursing homes because they can't support and take care of themselves. So there are some characteristics of long-term care. The first is variety of services. So some people require minimal care, like just getting fed, doing chores around the house, etc. Other people require 24-hour care, like getting dressed, help going to the bathroom, or even to feed them. Others need therapy or social services, and the list goes on and on. Services are also individualized, so care plans are made to best go with the patient's personality, their likes, their dislikes, their hobbies, all of that to make them feel as comfortable and independent as they can. Different services are also coordinated as well. For example, a person could have been hospitalized after, say, hip surgery, and then they're going to have to go to rehab, they're going to need home care. All those different facilities and organizations can be coordinated together into one plan. Providing a feeling of independence is also an important factor because no one wants to feel like they can't take care of themselves. So letting a patient do certain things on their own or making it seem like they're doing something productive is a good idea. Long-term care could be weeks, months, years, or even until the end of their life. A patient's physical, mental, social, and spiritual health must be taken care of too. Physical health includes medical exams, care, and medication. Mental health could include changing the layout or decor of the house, adding plants, flowers, pets, and making sure they have things to do. Social health can be maintained by making sure they are having visitors, playing games, or encouraging them to attend nursing home activities. Spiritual health includes their religion and values. The patients in long-term care should be receiving the best quality of their life. Community-based care is informal caregiving, it's cheaper, and it's non-institutionalized. An example would be home health care. This is when a nurse comes to your home and makes sure the person is changed and eating. They could be doing meal prepping, shopping, chores, transportation. To qualify for this type of health care, the patient must be homebound and require care. Adult daycare is another example of community-based care. This is a daytime facility where family members can send the adult to entertain and take care of them for the day. For example, if the relative has to work and cannot care for the adult that day. Senior centers is a place where seniors can go to socialize, play games, and chat with fellow seniors. There's also home-delivered meal programs and handyman services that are community-based care and can help the senior citizen or the patients in long-term care. Institutionalized long-term care is for patients who cannot live by themselves and need more than community care. Retirement facilities do not give nursing care, but give living space, and that could have emergency call systems or similar services. Personal care facilities is basic assistance. They manage and help with your medication and housing repairs. And then assisted living is 24-hour care. They bathe, dress, help the patient go to the bathroom, and help them eat. Assisted living facilities also try to incorporate social activities and games to make the best quality of life for the patients. And lastly, hospice, which is end of life care for the patient. In conclusion, I think long-term care has so many benefits for patients and it has helped so many people, but I think there could be a lot of things done to make it more affordable and convenient for patients. Thank you for listening to my presentation. Hope you're staying safe, and my next slide is my references.